Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Thanks again to Hubbard Radio for allowing us to use their recording space and their equipment and allowing us to continue to offer our podcast to the community. I'm here today with Bill Whitney. Bill will introduce himself, but I've been privileged to be able to work with Bill, get to know Bill over the last 6 months or so, and it was a fast friendship, I will say, and has kept evolving. So Bill, do you want to introduce yourself to the guests?
Sure. My name is Bill Whitney, and I am a man in long-term recovery, and what that means for me is that it has been nearly 17 years since I needed to take a drink or a drug to manage the circumstances of my life. And what that has given me access to is a life to which I did not have access before, because I had a shame story in my head and I had some challenges from my past that caused me to medicate myself. And as soon as I stopped relying on, well, in my case, as soon as the medication that I was using for myself stopped working, I found myself in a hole that only Alcoholics Anonymous and a community of people who knew what it was like to be in my head, and in my case, the awareness of a loving higher power that I call God, helped me to feel like I didn't have to do this by myself, because I had convinced myself after 47 years that I couldn't manage my own life without help. Wow. And I'm the happiest guy I know.
That's amazing.
Yeah.
You are very much a happy guy. I know everyone can't see you right now or maybe feel it, but I know it to be true. So when we met, I don't know, I might have a different memory of this day than you do, but I remember it. We were at the Recovery Fest in Kirkwood. Right. We have a mutual friend, Jim Murphy, who's also been a guest on this podcast a couple times throughout the years. And but I had not yet met you, Bill. And I was standing at the Prevent+Ed table at the Recovery Fest, and this gentleman walks up to me and says, "Oh, Prevent+Ed," and then looks at my name tag and says, "Jenny Armbruster, I've been looking for you." And my reaction was like, well, I didn't know I was hiding, or else I was hiding very well. I welcome. Hi, I'm Jenny. And you say, well, I'm Bill. And you just started telling me lots of amazing information about your passion about recovery and recovery community organizations or recovery community centers and your journey, and that we should get together and have coffee sometime. So we exchanged cards and numbers. You introduced me to Kat, and then you all came to my office and we shared a cup of coffee and talked more. So that conversation was really centered around the idea of course, getting to know each other and those types of initial thoughts, but then really around the recovery community in St. Louis and kind of what your experience had been here and in Georgia, and then what we might dream big about here for the region. So let's start back. Tell me a little more about the work that you and Kat did in Georgia and that recovery group that you built there.
So I'm going to use the acronym RCO when we talk about recovery community organizations a lot, and just I want to make sure to put that in. I wasn't familiar with RCOs. I had fallen in love with a wonderful woman in Georgia, and I moved down there. We met at a leadership conference in Chicago, so it makes perfect sense that the guy from St. Louis and the girl from Georgia would meet in Chicago and decide that, hey, there's a future in this thing.
Yeah.
Fortunately or whatever, I was too hard-headed to accept her rebuffing the notion that there might be something for us. She had a very, very big life and a bunch of kids. And anyway, I get down there and I had every intention of starting a branch of the business that I currently have here. down there, and part of what catalyzed my moving down there pretty spontaneously was that she had been walking around with a torn rotator cuff for months and months and months. And it's the kind of injury where if you don't address it, and Kat's in her late 40s now when this happens, and I happen to be at her orthopedist's appointment. If you don't address these things pretty quick, they can have long-term ramifications for an old age with just very limited mobility.
Right.
And she and I are both very active, and we like to scuba dive, and we like to hike, and we like to travel and all this stuff. And that's just not the kind of thing you can do with one arm. So I volunteered to come down and basically effectively move in and help out while she went through this surgery. And her orthopedist looked at her and looked at me and kind of looked at her and said, "You're going to take this gift because you need to get on my table now." And so that's how I wound up there. And she had started an RCO, and she doesn't mind my sharing that she obviously is also a person in long-term recovery. And after she returned from treatment in the mid 20-teens, she watched a movie called The Anonymous People.
Oh, yeah.
On whatever streaming service it was. And it introduced the concept of RCOs. Mm-hmm. And for those who are interested and have not seen The Anonymous People, it is a magnificent telling of what RCOs are and why they're so important and so helpful.
I remember. I don't remember how many years ago it was, but when the documentary type style film came out, we did several screenings around the area. So I know that I've seen it a few times, and I believe there might even be a DVD of it if anyone still has a DVD player.
Absolutely.
Probably
well,
at
you
our
can rent it, I
offices,
think, on one of the streaming services.
Absolutely,
too.
Yeah.
One of the people at the center of that effort is a man named John Shinholzer, who has he, along with his wife Carol McDavid, who is a United States representative, were very, very active in the field of addiction recovery and recovery support services and peer-based recovery. So Catherine, on her own dime, picked up the phone, called up this guy Shinholzer, who was up in Richmond, I think, in Virginia, and he agreed to let her come up and shadow him for a week and learn all that she could about it. Loved the concept and took it back to Cumming, Georgia, and started an RCO. And it was, and it's.
So tell us. So can I interrupt one second? Tell me about. You said Cumming, Georgia.
Cumming, yeah.
So what type of area is Cumming, Georgia? Cumming,
Georgia is, well, historically it's been rural, very rural.
Okay.
It's unfortunately had a very sort of infamous past. And I don't want to elaborate on that at all. But it is it's the county seat of Forsyth County, Georgia.
Okay.
And it's right on Lake Lanier. It's a beautiful country, and very, very well to do. And so the idea here, the thing that's most important about it, you need to understand a little bit about addiction to really understand why RCOs and why the grassroots, why the peer-driven model is so terribly important, outrageously effective, and very remarkably affordable. I didn't go to treatment. I just hit the bottom and went to Alcoholics Anonymous, and that's a peer-driven model that is outrageously successful. I think that there are a lot of misunderstandings about it, partly because the recidivism rate has always been very, very high. And what you'll learn from talking about addiction and studying it at all, one of the things that you got to have to be successful in long-term recovery is absolute commitment. We refer to it sometimes as bottoming out. But if you get mandated to come into any kind of recovery and your heart's not really in it and you really haven't reached a point in your life, we call it the gift of desperation, that you just can't go on anymore. And I call it the cold stove moment, because in my case, one night I drank a bottle of gin and I couldn't get drunk anymore. And I thought, oh my gosh, the jig's up. And so I literally put my hands on a cold stove and I looked up to the heavens and I said, this can't be what you had in mind for me. And that was my surrender moment.
Right.
So don't be misled, world, by the very high incidence of relapse that you often hear in recovery, because what nobody ever knows is that after that, people come back. And they keep coming back, because once a real alcoholic or an addict has had the idea of recovery and been witness to a community of people who know how to live happily and in their own skins without using, once you've been exposed to that, it never leaves you. I like to say, a couple of AA meetings will screw up your drinking life pretty severely. And the good news is that we don't care. We in recovery, we in RCOs, we're there no matter what. We're there to support each other. I need a higher power, and I have to have peer support. I've got to have a community of people that know what it's like to be in my head, and because first of all, I need to be able to trust them, right, as an alcoholic, and far more importantly, I need to know that I can be vulnerable safely. Mm-hmm. And we are very, very good people with a really, really rotten disease that likes to tell us that there's nothing wrong with us. And that is a really dangerous combination. Mm-hmm. It is a disease that is centered in my mind. So there's nothing to me more effective. Let's put it this way. I think it's impossible to get sober without a supportive community.
Yeah, because you need that support, but then you also need people for accountability, to hold that mirror
for a lot
up a
of
little
things.
bit.
We don't come in on a hot streak, right? Mm-hmm. So typically the lives that we're leading when we first come in are inhabited by like-minded people. Most alcoholics and addicts that I know, when they're active in their addictions, hang around with alcoholics and addicts. So when we start to get well, the people we used to hang around with, with all respect to them, aren't good for us.
Right, not healthy.
If we come from a family environment, and it's a family disease, and I will tell you, without going too far into it, my mom has 5 kids, and 5 of us are alcoholics. And one of us had to take his own life, and I'm the example of the guy that went the other way. But the thing that matters most to me is that I have a group of people in my life, and now it's literally hundreds, and also literally so, that I can go to an AA meeting anywhere in the world and feel like I am with family.
With family.
Yeah.
So that's that AA community.
It's not just AA.
Well, not just AA, but that recovery
that is the
community.
Recovery community.
Yeah.
The recovery community is it's the most level playing field you've ever seen in your life.
Yeah.
Right? We don't do hierarchy. We don't do judgments. Our primary purpose is to stay sober and help other people recover. Right. That is the mission of the recovery community. It costs nothing, and if you want to stay sober, I've found that one of the best ways to do that is to help other people get it.
I love that.
And it's wonderful. I mean, you learn how to live a life that most people who that don't have addiction in their lives, that most people don't realize they can have. Mm-hmm. It's really I've never been as free as I am today.
It's beautiful.
And it's not unique to me. No. I think Alcoholics Anonymous, in a lot of respects, are the programs of recovery, regardless of the pathways, are a model for living that the whole world can adopt and maybe be a better place. Mm-hmm.
It's wonderful. So that's the recovery community, and that's the power and the feeling and the support and all of this that makes up their recovery.
And you don't need
community.
anything to start. I mean, I'm going to get back to answering your question.
Yeah. Well, I was going to say, then what's the O? Because we said the recovery community. So what's the
Kat
organization?
went back, and she follows a different pathway from AA. But she started. They started having meetings. They started having meetings wherever they could, and they were. They had a community base. It happened that she was a therapist in the accountability court system. My wife is an incredible woman, and so there were. I mean, if you think of the recovery community as a business, there are people that are dying of, we've got customers everywhere, right? We offer relief. We don't. The only requirement for membership is a desire to get well, right? So if you have this community and you're offering it up to the world, and it's not costing anybody anything, and all it really needs is a place for people to come together, it's really a pretty simple thing to establish. So they started doing this, and they were having great success, and more they were helping people in the drug court, in the DUI court systems, come out of those programs and not return to drinking and using.
Yeah.
And that's it. I mean, I'm oversimplifying it. So she had created this thing, and then the state of Georgia has this huge network under the auspices of the Department of Behavioral Health and the Georgia Council on Substance Abuse of RCOs. Now, RCOs are important, are unique because they exist and they're local, so they exist to fill the gaps or meet the needs of the recovery communities in which they reside. So in wealthy areas or in urban areas, the needs aren't the same as they are in rural areas. In rural areas, as you and I know from the work that we're doing in Jefferson County, transportation is an enormous barrier to recovery. RCOs exist to help meet the Maslowian level needs, basic needs of people who are in recovery, because if you haven't got housing, or if you haven't got transportation, or you haven't got your papers, or you haven't got health care, your recovery can't be the top priority in your life.
Right.
If you get kids, you have to feed these people. And if you're new in recovery or God help you, just out of jail, the barriers to gaining long-term recovery are huge.
Well, and I think that's really, the work of that recovery community as we're talking about it, or, even the explosion of certified peer specialist type services, that same kind of peer model idea, is that those barriers are huge, and they don't have to be that huge, because sometimes,
and they're not new.
But sometimes that thing like a ride somewhere, or help getting your birth certificate so you can apply for a job, or
a driver's license,
or a place to be able to have visits with your kids if there's been complications there. Those are real barriers and can make a huge difference, but there's not always been a way to have that type of support to say, oh, hey, let me help you go get this driver's license, or let me get you a ride here, or let me do these things. So it's those barriers that, again, create all the difference, and there's so much gap around, but don't have to be that huge. And that's, part of that recovery community is that piece of it too.
What's also true is that when you're new in recovery, particularly, the first year is such a deal breaker, a potential deal breaker. I'm sorry. The first year is one of extreme vulnerability for a new person in recovery. It doesn't occur to you that there might be resources available to help you.
Yeah.
With health care, with child care, with transportation, with getting some clothes. I mean, when you come out, you're naked, and like I said, not many people come into recovery on a hot streak. I mean, you don't typically go in with a bank account full of cash. Shoot, I had a perfectly good job, and I am not a man without means. But I mean, until I got sober, I got pulled over early in recovery one night, and not realizing it, the tags weren't updated on my car. I like to say I brought a cop to an AA meeting, and it's a little bit of an amusing story, but it's the truth. I was new in recovery, and I'm on this pink cloud of like, oh my God, I can't believe I'm sober. My stomach doesn't hurt, and I'm terrified. I can't believe how fortunate I am. I'm like a newborn chick right out of the shell, and just kind of shaking all over the place, but enormously gratified that I'm not incarcerated in this self-serving addiction.
Yeah.
I pulled into a meeting one night, and the cop had his lights on, and I was brand new. I'm sure I didn't have more than 2 months sober, and it was a Sunday night, and I pull into the meeting that I'm going to on Sunday night, and there's a cop on my tail, and all of the people from the meeting, because now I've been going there for a couple of Sundays, and they're all looking out for the new guy, and this is the recovery group in action. This is recovery community in action. They all come running over, and they want to know what's going on. They were like, they came to my rescue. They implored the cop. You can't take him. He's doing the right thing. He's trying to get his act together. All of this other stuff, and God bless him. He was such a nice young man, but the sergeant, his boss told him basically, no, you got to hook him up, which meant you got to put him in, you got to put him in cuffs. You got to put him in the back of your car, and you got to bring him up here. And I can't remember his name, and it's good that I can't. But he was in tears having to bring me in.
Oh.
So he dragged me through this whole process and got me the heck out of there in about 25 minutes, which is unheard of. And when it was over, rather than just kick me out onto the streets of Clayton, Missouri, he said, "Where are you going?" I said, "Well, it's early enough. I can go back to my meeting." He said, "I'm giving you a ride." I don't know much about getting taken in and spending the night in jail or anything, but I've never heard of a cop offering
The ride
to
back,
give you a
too.
ride
Yeah.
back. So the consequence of that, of course, is that I made the meeting with about 5 or 10 minutes to spare, and there was no sneaking in the back door that night. They're all looking at me, and I'm feeling all sheepish, and the meeting is not going to move another muscle until I open my mouth and say something.
Talk about what has happened, yeah.
Yeah. But what made it easy to talk about was that every single one of them knew exactly what I was going through with that, on that perp walk back into the Alcoholics Anonymous meeting. That's why it works.
Yeah.
It works because we're all the same. We all have problems, but AA's been around since the 30s, the 1930s, and I'm getting old. And every single problem that somebody brings into the community has been had, and it's been solved. And we want to tell you how how we solved our problem so that you can work on yours.
Share that knowledge.
The volunteer spirit and the recovery community owns the responsibility way out loud for seeing to it that the people that come in have everything that they need to be as successful as they can.
It's amazing. And I've seen that power in action. And recovery community organizations have been on my radar. I know there's several throughout Missouri, but there hasn't been one in some of the rural areas that we serve. So it's been something on my radar. So, the day that we met, and then when you and Kat came to Prevent+Ed, and we had coffee together, we were talking about RCOs, and I know you were really jazzed and feeling some energy around, like, how are we going to get one in this area, or what can we do to support, or what type of resources are there? And we were just having all kinds of conversation. And I also think of you and Kat really as my good luck charms, because I had shared with you that day too that we had an application out, and we had been really looking at how can we expand this model, and how can we again build this recovery organization, this recovery community in Jefferson County. And so we were in conversation with the Jefferson Foundation about the possibilities of this, but hadn't heard anything, and you all left, and it was the next week that we got notice, and I was able to call you back and say, okay, well, if we want to keep hanging out together, we can work on this project. So well, it was very serendipitous, that it all kind of came together.
Yeah, and oftentimes that serendipity for me shows up in another cold stove moment where I put my hands down and I look up and I go, show off, because these things all come together. So I want to quickly finish up on this Georgia story and the birthing story of the connection, which is what the RCO was called in Forsyth County. There are 38 or 40 something RCOs now in the state of Georgia, and they do a hell of a job. when a bunch of the opioid money came down from the government, grants were being issued to the state, by the state, to communities that wanted to have RCOs. And one of the state senators contacted Catherine, knowing what she was up to in that area, and there wasn't anything like it in the area with her little RCO, and said, if you'll write a proposal, I'll see to it that you get your grant filled.
Yeah.
And so bear in mind now, this is with a torn rotator cuff and this guy, this not small presence, moving into my house with these kids who've never met this guy. I mean, there's a lot of turmoil in her life, but she had applied for it. And right after I got there, or just as I was getting there, the grant had been approved. And she goes in for surgery June 4th, and we open the doors of this RCO on September 1.
Wow.
And anybody that knows anything about rotator cuff surgery is that it takes about 2 months to recover.
Yeah.
So that sort of caught my attention. Work-wise, I wanted to help out as much as I could, learn what I could, because I didn't know squat about an RCO. And it's the county said, okay, we got a building. We're not using it. You can have it as long as it's not being used. And that really jump-started it. And she had been doing listening sessions around the community so that we could identify the things, the holes that needed to be filled, the needs that weren't being met as fast as possible.
Yeah, what are those gaps? Yeah.
And I hearken back to that because when we were talking about this thing in Jeffco, I started hanging around at the Drug Prevention Council meetings down in Jefferson County, and they have done a magnificent job of cataloging all of these resources. Jillian Bissell and her group, they do a magnificent job in Jefferson County of meeting the needs of people who are seeking recovery. And so they have this fantastic resource guide that they publish and these really, really good connections and coalitions. And so for us, when we started doing listening sessions as Prevent+Ed in the county, there were already a lot of things that were being covered, and a lot of people don't know that they're there.
Yeah,
right?
Absolutely.
So one of the missions of the as yet unnamed RCO in Jefferson County is to see to it that catalog is available to everybody and anybody that's trying to get sober, that's trying to trying to change their lives, transform their lives, and partner up with the people, not just in the existing areas, but create possibilities for the areas that are not being met, and transportation's a big one. And clearly, we're in discussions about how to do that. And it happens that there's an RCO in rural Georgia where transportation is the basis of their RCO.
Yeah,
so while they have a club,
it's like an RCO on wheels.
It is an RCO on wheels. They have a clubhouse. I mean, they have a little center, but they have a fleet of automobiles that they staff with certified peer specialists to go around and help people. One of the in rural areas, and this is an obvious one, if you're a person that's new to recovery or just out on some kind of paper, some kind of judicial paper, you got to go to meetings. You got to go to recovery meetings, and you have to go to parole meetings, and you've got to go to, these are the accountabilities that and if you don't have transportation, there is no way in the world you're not going back to jail.
Yeah.
It's impossible.
You're going to miss something.
Without
somewhere.
a ride, if you get kids and no wheels and you live in a rural place, the likelihood of you sticking around with your kids is terrible.
Right. It's unfortunate, but it's true. I mean, that transportation is such a barrier.
And we can talk about that till we're green in the face. And what we also have to do is take a look at, do you realize the effect that this can have if we can provide transportation for some of these people? Do you know the number of people who are not going to stay in or who are going to get out of the cycle?
Yeah.
Do you know the number of people who will eventually forget the sheriff's name?
Well, hopefully that's a big number.
It's huge. So, it's not a difficult thing to support. For a person for anybody who has gained the kind of blessed life that I have, being freed from addiction.
Yeah, it's wonderful. So, I mean, we could keep talking, and but I think there'll be probably more to talk about, more to come, as we are really close to opening a recovery community organization or center in Jefferson County. Coming very soon, hopefully, to the area. And I just thank you, Bill, for kind of showing up when you did and saying, hey, what's happening in this area of the world? And I have some knowledge and I've seen it firsthand in Georgia and I want to help.
I probably owe you an apology and it's late in coming, but I'm not a small personality, and I'm pretty sure that when I introduced myself to you at Recovery Fest last fall, you kind of had this look like, yo, buddy, you need to back up just a little bit because I have no idea who the heck you are.
Yeah, well, that's okay. That's usually how great things start, right?
That kind of zeal and that kind of passion exists everywhere in the recovery community, and we are people who just want to be good citizens like everybody else.
And that's what, just bringing people together and having that opportunity to allow it to happen, I think is the magic of it.
Yeah, you're right. And magic is the word too. It's a great life, and until we reach all of the people that want the help, we should keep doing this.
Absolutely.
It's not very hard to do, and I think that the world's a better place when RCOs are able to thrive. And thriving just looks like, leaving some vacancies in the jails.
Yeah, absolutely. Having a few more people that aren't in a jail or an emergency room, or
and having some more people available to serve their communities. Right. I used to. I have to laugh sometimes at the garbage that used to roll around in my head. But I remember thinking, because I knew I was an alcoholic for many, many years before I quit drinking. I just had so much shame I would never admit it. So the idea, when I first came in, I said, yeah, well, most alcoholics are egomaniacs with low self-esteem. And I was like, oh my gosh, that could be my epitaph. No, I used to say to myself, if I can't drink, how am I going to have any fun? I had a brain that,
that was,
the left side of my brain manufactured garbage and the other half of my brain bought it every single day, and business was always really good. And now I wonder how the hell I had time to drink. Because life is so full.
Yeah. And you're having a lot of fun.
Yeah. And I know a lot of really great people as a result of it.
That's awesome. Well, I'm going to ask that maybe we do a part 2.
Let's.
And you can come back when we have the RCO open in Jefferson County, and we can talk about what's happening there and some of the great things that are going on. But until then, we'll just want to thank our listeners for tuning in. If you've liked what you heard and you want to hear more, please subscribe to The PrevenTable at any place where you access your favorite podcast. And another thank you to Hubbard Radio for allowing us to use their space today.
Hear, hear.
Thank you, Bill.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.